Hi, this is Dr. Tom from OrthopaedicSpineDoc. Welcome back. Today we'll be talking about causes of erectile dysfunction and their management. So erectile dysfunction is a very common thing that we see in males over 40. And there are many causes that may arise from diseases like diabetes mellitus, which affects your sugar levels and affecting your arteries with atherosclerosis. If it's not well managed, that can lead to sexual dysfunction. Some could be on medications like antihypertensive medications that might cause erectile dysfunction. Some might have surgery down there for various reasons, including prostate removal, that might have some sexual dysfunction. And then the doctor from a GP can assess some of the common causes that can be seen from history and clinical evaluation, and blood tests could be done to exclude some of the common conditions, like we said, diabetes mellitus, to see if the sugar is well controlled, and also to see if the person may not have coronary heart disease, vascular disease, that can then be picked up by checking, your pulses in the feet, in the hands, and checking your blood pressure measurements, and also blood pressure measurement in the thigh and in the leg, and see if there is discrepancies there for vascular disorders. And then for cardiovascular disease in the heart, specifically, one can do a cholesterol profile to check if the cholesterol is well managed. And then in those cases where the GP may not find out the cause after doing a basic examination, referral to a urologist or a physician interested in sexual function could be a useful referral. However, some cases may find that no specific findings can be found, and like my urologist says, the brain is the main sexual organ in the body, meaning some cases there may not be organic factors but functional problems that might arise from anxiety, poor relationship with a lady or a wife, and so on, which can then be assessed and treated adequately with a urologist, clinical psychologist, or a sexologist if available or if needed to be. Majority of individuals might just have poor erections related to aging process from 40 years onwards, and also as we reach 40, 45, our testosterone levels go down, and also our muscles tends to weaken, including muscles down there. So in this case, the most important thing is to do regular Kegel exercises. And these Kegel exercises is like if you're passing urine and you stop passing urine immediately while you're in the toilet. And during that process, you're constructing your pubic muscles. And if you can do that 100 times in the morning, so you do your exercise, say 1, 2, 3, 4 until 10, and you go through your fingers until you reach all the 10 fingers. You have done 10 times 10, that's 100 Kegel exercises, strengthening your pubic muscles. And if you can do that during the day and in the morning when you wake up and around midday, and then in the evening, then you'll have very strong muscles and you'll have powerful erections, which will help you to have strong erections that will help you to alleviate erectile dysfunction. And also it will also give you powerful orgasms. And also you are able to control the pacing to reach orgasm, which is very important. So on YouTube you'll see a lot of YouTube channels talking about certain recipe that will give you or cure erectile dysfunction. It's a myth. Obviously, studies were done in the 60s, 70s, where patients who've got serious coronary heart disease, they were divided into two groups, what we call double-blind studies. The first group, the cardiothoracic surgeon just open the chest and don't do anything and close. The other group, they open the chest and do a bypass surgery. And the ones that they just open the chest, they found that up to 30% of them reported marked improvement, despite that they didn't have. The thing is what we call it's just your mind or what we call placebo effect. So probably that's what's happening in this diet that are being given on YouTube, that you have got garlic and you've got some carrot and some beetroot, and you drink every day, and then you cure your... Obviously, good diet is very important, and a good diet, you have to have a diet and be about 60% proteins, meat, red meat, chicken, eggs, and that type of thing. If you're vegetarian, get lentils, nuts, and things like that to have a good protein constituting 60% of the diet. Then be 20% carbohydrates, and then the remaining 15-20% being fats, and preferably fats that are rich in like in avocados, eggs, type of thing, fish. Those are very healthy fats that are very important, and we need fats because all our hormones are mainly made of fats, so it's very important. We also need carbohydrates because our brain uses carbohydrates only, though the body can convert protein and fats into carbohydrates if carbohydrates are not available, which is quite important to note. And also to have a diet rich in antioxidants, which helps to make our cells healthy, otherwise from metabolism of carbohydrates and also fats and protein. And vegetables that are very colorful, like beetroot, carrots, are very rich in antioxidants, as well as fruits that are very colorful, oranges, apples, and so on, rich in antioxidants. So that will give you a very rich diet, a very healthy diet. And also remember to have exercise. And healthy exercise, the body needs just about 20 minutes of intense exercise every day. And in men over 40, exercising will also increase your testosterone levels, which will increase your libido and also help you with erectile dysfunction and as such, which is be very helpful. Cheers.